Our panel is moderated by a woman who's very dear to me. Her name is Bea Baylor, and I'm introducing her because I love her. She is an author, a speaker, a life coach, a business coach, and she has helped thousands of men and women change their lives. She has overcome incredible hard times in her life to become a leader in positive change. And I'm honored that she's going to lead this panel today. And this panel is about the future of wellness. So I'm going to invite Bea up onto the stage, and then Bea is going to introduce the 4 panel members. So round for Bea.
Thank you. Thank you, Melanie. Hello, Austin. Are you well today? I'm feeling well. All you beautiful people, you're fabulous, plenty of food, and I am not at work. I'm feeling well. When I leave here, I'm not going to go back to work. I am so excited. We want to take this opportunity to welcome a super dynamic, uber educated, fabulous CEOs, executives to the stage. Let's have Susan. Susan, tell us.
Hi, my name is Susan Thompson. I work for the Cooper Aerobics Enterprises out of Dallas in our wellness management consulting division. And my primary client, I'm fortunate enough to work in Austin for National Instruments.
Thank you, Susan. Next, we'll have Andrew.
Thanks, Bea. Hi, I'm Andrew Lowe. I'm with Blue Goji, who's exhibiting over here their corporate wellness program, Game Breaks, and we try to make movement and exercise fun for once.
Thanks. Next, we'll have Louis.
How's it going? I'm Luis Rincon. I'm the co-founder and CEO of wearables.com. We're a site specializing in wearable technology, both the commerce and the content side. Wearables.com. Just check it out.
Wearable.com. Next, we'll have Austin.
Thank you. I'm Austin Steves of the City of Austin Health and Human Services in the Chronic Disease Prevention Control Unit in the Office of the Medical Director. Long title, basically I help organizations implement wellness programs.
All right. This is my fabulous speakers that have questions, and I'm sorry that we're not going to be able to allow the audience to do all the questions, but I can assure you that this educated panel have come up with some really hard questions. And today, we're going to talk about the future of wellness. You see, you heard about the calling. You know that we're not moving enough, and you know that we are not exercising enough, and we're sitting down, we're not eating right. I'm feeling really bad about the future. Are you guys feeling bad about the future? Well, we have put together, I'm going to eat, right? I'm going to just keep on eating plant-based, right, Rip? We have a group of people that we've come up with the questions and the answers. And these guys have also been around in the wellness industry, so they know what they're talking about. So let's go ahead and get started. And I'm going to start with you, Susan.
To define wellness in the workplace, I believe it's looking at employees and maintaining or improving, and maintaining is a key word too, or improving their emotional, mental, and physical well-being. And I think we do a pretty good job, or we have in the past, really focusing on the physical well-being and nutrition, although the science of nutrition is always changing as we're learning today too, but really needing to focus a little bit more on stress and sleep, but then also equating well-being back to self-efficacy and remembering that we're looking at the workplace, we're looking at ROI and all these the numbers and return on investment, but we're also looking at individuals, and we've got to tie back in to why somebody wants to change, like Art was talking about earlier, creating those supportive environments for change, but letting people find the intrinsic meaning on why they should change their behavior and get healthy. Once you tie that back in to some of the cool technology and motivation that some of my colleagues up here are going to be speaking a little bit more about, then I think you can make a big impact on well-being in the workplace.
Thank you for that, Susan, and that's really something to think about. Louise, can you elaborate a little bit more about what does wellness in the workplace mean to you?
Sure. So in terms of my application based on technology, I think that's a better angle for me to tackle that question. Technology, broadly speaking, should have two core goals with wellness programs, and that's to drive and to sustain engagement. Just as Susan talked about, one of the key factors there is maintaining, and that sustain feature of technology is actually really key to wellness programs presently. Wellness programs, in terms of technology aiding wellness programs, really occurs around 4 core offerings presently. I think it's going to evolve as technology evolves, but presently it's social peer-to-peer apps, and this reinforces peer and community behavior. And then there's wearable devices, which obviously is what we specialize in. And then data integration, the amount of data that's being produced, even outside of wearable technologies, is massive compared to even just 5-10 years ago for corporate wellnesses. And a lot of platforms are actually being very intelligent in how they leverage that, analyze it, and then integrate it. And then the last is personal digital coaching, which Andrew might be able to speak a little bit more to, and that's more about around the sustained engagement piece, specifically sending you updates of how you're doing against goals and then what you can do to more actively hit those goals. So I guess if that somehow answered the question, it's more about driving and sustaining engagement using technology for me personally.
And that is basically one of the technologies that you're utilizing in other companies?
Sure. So we don't actually activate any sort of corporate wellness programs. We work with a lot of people in our industry since wearable technology is so prevalent in corporate wellness. We interact with a lot of these companies, specifically on the device side. We're familiar with quite a few of the platforms, whether that be on the insurance side or even third-party platforms. And they definitely instill all 4 of those offerings to help sustain engagement. Absolutely.
Thank you, Louise. You know, because of Austin, Texas, I think we are really big in the state industry here in Austin, Texas. So I'd like to hear from you, Austin, because you're from the Health and Human Services. And I want to know, what does wellness in the workplace at the state level mean to you?
Yeah, so when we look at general wellness programs, it's kind of the 2 kind of tierfold. We have the participatory, which is your standard asking people to go to the gym, participate in that, and the outcome-based, which is your health assessments. When we look at it from a population-based health, how can we really affect individuals? Because you can do that, other stuff, and it's the individual. But when we look at the population, the worksite, the organization as a whole, what can we really do to implement, make incremental changes? And so wellness for us, in the Health and Human Services standpoint, is looking at how can we implement system and environmental changes that can really affect an organization as a whole.
Thank you. Next question. We're moving right along because I want to know, Susan, what type of wellness programs are being used today? Because you're one of the big gurus in the National Instruments, so tell me.
So a little bit about our program at National Instruments. We kind of have a 2 or 3 step program. We do a combination of what Austin just spoke to, participation programs, and biometrics. We drive that first with wanting our employees to know their numbers. So we do health screenings, and it's a little bit of a disincentive approach, but that gets people's attention. What we don't take it to is the outcomes. So we tell people, we want you to participate, we want you to know your numbers, and then you can hopefully want to do something about this, and we will provide you with the support and programs you need, and we want to meet them on a lot of different levels. We have employees that are very athletic and very driven and very fitness oriented. So we want to find out what they're interested in. So we provide a lot of activity-based programs for them, and we have created committees from those employees who are interested in those activities. We pull them in to help drive the engagement. The engagement is huge. One thing that we also do to promote our biometrics program is we adopted a message from Dr. Cooper that the our senior leadership thought was important. And we told them, why do we want them to care? And one of the messages is it's not your health is not your government's responsibility. It's not your employer's responsibility. It's your responsibility. But we will provide you with the programs if you want help. We also have employees who are, they're not ready to do the bike rides. They're not ready to do our 10Ks. They're not as competitive as some of our the 50% of our population that's very fit. So those activities aren't really engaging to them. What we try to do is find programs that are more centered around coaching and individual and small group programs so we can meet those high risk or moderate risk employees who do want change and they're ready to change, and that is the key. Meet them where they're at and provide that environment for them. For those employees, we're going to have to build, again, I talked about self-efficacy, and the self-efficacy is believing that they can change. And that's got to start with small goals and developing those personal relationships and supportive environments. All of that's going to develop the culture that I think has made our program a success at NI. I think there's something for everyone to do in our wellness program, and we try to not have a one-size-fits-all program. We still want to collect that data. We still want to report on return on investment, and we do that, but without driving the programs through the personal relationships, we will not be as successful.
Thank you, Susan. So, Andrew, and that leads to the next question. What will it take to drive mass adoption of wellness programs?
So I'll probably say something that's not very popular in my industry, or at least amongst my industry
We knew
peers.
Andrew would say something not popular.
So I really think we need to transition from providing wellness programs, and this may look different depending on the organization you represent, but transitioning wellness programs from how they're structured as opt-in programs, meaning people can participate if they choose to, and you provide them with a variety of things to do and incentives to get them to do that, to opt-out programs. Anybody familiar with that term, opt-out? The analogy I like to use is something pretty unrelated, but organ donation. So if you look at all the countries across the world where they have a policy for their citizens to donate their organs at the end of their life to potentially save the life of another citizen, like the United States, participation averages somewhere between 2 and 20%, which is oftentimes what we see in the wellness industry, unfortunately, because most programs are opt-in. If you look at countries that have an opt-out organ donation program, a lot of them are over in Europe, almost all of them have above 90% participation, meaning over 90% of citizens donate their organs at the end of their life to potentially save the life of another. Why is that? It's the exact same action, right? It's organ donation. It's just simply how it's structured. And so if we can provide wellness programs where it's harder for people to not do it, whatever that is and whatever that looks like, than it is easier for them to not do it, I think our participation rate will go through the roof and we'll see mass adoption.
So, Austin, could you elaborate on what Andrew just said?
Yeah, just a little bit. I agree with him and disagree just a little bit.
Agree to disagree.
Just a little bit. When we look at mass adoption itself, when we look at how can we make incremental chronic disease, because chronic disease, we look at healthcare expenditures, about 75% of it can be related to chronic disease. How can we reduce this? So we can implement programs that really aren't relying too much on the individual employee itself. So you can look at strategic system and environmental changes. So this could be a tobacco-free policy, which doesn't require the employee itself to engage in it. I can't smoke or do whatever on the work site itself. You can do a lactation support policy. You can do a healthy vending policy where you can require 50% of the vending machines in your organization to require to have healthy items in it. So there's little incremental changes you can do around the work site itself that could really involve an employee in it, whether they think they're involved or not. So I think there's kind of a twofold approach there we could do.
Very good. I like that. Louis, I would love for you to just kind of elaborate a little bit about that so we can move on to the next question.
Sure. In terms of driving more adoption, you mean
Absolutely.
mass adoption?
Yes.
I think we're really only beginning to see, again, sorry for sticking with technology, but that's just my background, so it's easiest for me to discuss that. I think we're only really beginning to see outside third-party platforms interacting with internal corporate wellness. Traditionally, it's been really reserved to health insurance providers and the employers. I think there's going to be a huge opening, what I'm calling, it's not so much incentive-based, but more so achievement engagements. Brands are starting to really be interested in actually learning how they can reward people for certain achievements, right? It's slightly different, though mildly confusing in terms of how that works with incentivizing. Perhaps the most well-known and the one that I think is doing the best job of it is actually Walgreens. I don't know how many people here are Walgreens customers, or if you use their app. It's a fantastic app. It's probably one of the best app experiences for smartphones. And what they have actually done is you can implement other devices, regardless of who your employer is, regardless of what the corporate wellness structure program is. And actually tied in your activity data there to receive discounts. And there's been some interesting articles that this has actually led to in-employer increase of corporate wellness programs because people are becoming more aware of this outside of the office, which is unique in that traditionally corporate wellness programs have been organic to that whoever your insurance provider is or that employer. Now it's coming out from brands going inside or outside in. I think we've only begun to see the tip of the iceberg of how that's going to work, especially as mobile technology, not just wearable devices, but smartphones continue to increase.
So we have a panel of 4 that you just heard about mass adoption and all 4 terminologies, and I think that's really interesting how each speaker has a different terminology of mass adoption in the workplace. It's taken us to the next question. What role will technology play in advancing wellness in the workplace? And this is really huge because we're big, techni-savvy people in the workplace. We want our smartphones. We want our iPhones. We want our tablets. We want we can't go anywhere without technology. It is the thing of today. So with that being said, I'm going to throw this question out for you, Andrew, and then I would like for you, Louis, to elaborate on that. You are wearables.com, so I'm going to leave you, if Andrew can just briefly give us your take on what role.
Yeah, I think technology is the only thing that'll make wellness programs sustainable. Maybe not the only thing, but it certainly helps. When you consider that the average American adult checks their cell phone every 6.5 minutes, yet only goes to the doctor 1.5 times per year, makes a lot of sense to start driving wellness, communications, and incentives and all those things we do through this guy rather than through the doctor's office. And maybe to elaborate on that, this can also not only be an agent for good things, but also for bad things. So I've got an app on here, right, where I can go outside, push a button, and it starts tracking me. And then that tracking goes to my employer, and my employer rewards me for being active. So it's an agent of change. But I've also got an app on here called Push for Pizza. And in about 3 clicks of a button, I can have a pizza, hot, steaming, and fresh, delivered here in 30 minutes. So technology will certainly be an advocate for health and wellness, but it can go the other way as well.
That pizza works well at the conference, doesn't it? So, yeah, just to elaborate on that, Louis, because tell us a little bit about wearables.
Sure. So for those of you unfamiliar with wearable devices, typically the easiest way for me to say is, you ever heard of Fitbit? That's a wearable technology device. Specifically to this conversation, right? It's a lot broader outside of that. Stuff like GoPro, Google Glass, smart clothing. We can get into mHealth devices, but for the sake of this conversation, just activity trackers. An interesting stat, actually, in terms of corporate wellness. In the next 5 years, over 13 million wearable devices will actually be distributed through corporate wellness programs. Presently, I think it's about 6% of activity tracker owners, acquire their device through their employer. The savings here in terms of reduction in healthcare claims has been pretty huge. Some of them I even fail to believe myself. We've seen stuff for every dollar invested, there's a $9 return on savings. I actually found 2 case studies that were that high. One that's slightly more believable to me is about $3 in reduction or savings. I think, and don't go running to, if there's any health insurance people here, I'm really sorry if I'm making this claim, but my prediction is actually that a lot of this is going to be so heavily subsidized, if not entirely free, and going to Andrew's model, if it's opt-in, it'll actually be part of your starting employee package. You're just going to get some sort of, oh, by the way, if you've signed up with our, let's say Humana, we're with Humana, here's your Fitbit, right, or here's your Jawbone, and then it becomes opt-out, like, no, I don't want that, or, take me out of the entire program. I think that's one thing that probably you guys are more interested in hearing, just because it's a big buzzword, is the privacy around data. I really don't think, and I've had this conversation with a few people earlier before everything kicked off, it's the data as it exists right now is really not scandalous. There's a lot of people who are concerned, well, who's looking at my data? Like, who knows how many steps I took? But I mean, really, you got to ask yourself, is there a lot of concern with somebody knowing how many steps you took? If it goes past, like, if it goes into like prescription medication, then obviously.
So, Louis, Austin, can you agree with what he's saying?
Yes,
about
I will this time.
Technology.
Yeah,
Can you agree?
Yes, I'll agree with them. In the aspect of technology is not going away. It's something we really need, we have and are integrating in our everyday life. But it's something we can leverage too, from the pizza aspect of it. But there's our slogan we have in the office is make healthy choice the easy choice. And mobile technology or technology in general can really give you the opportunity to find a healthy restaurant nearby. It can tell you where a farmer's market is on the weekend. So there's a way we can integrate technology into our everyday lives that can affect corporate wellness or wellness in general.
One thing that I think we really try to focus on when I was talking about culture is we're trying to create the culture tonight with our message about, what I spoke to earlier. It's not your government's responsibility. It's not your employer's responsibility. It's your responsibility for health. And we really drive that message home at NI that you've got to take responsibility and you've got to care. And we drive that, and it's the right thing to do. And when employees find, again, going back to some of the happiness that our speakers were talking about earlier and creating that, tying that into a happy culture and a happy workplace, when they find what's intrinsic to them about why they should be healthy, then they're motivated to start making change. We try to work on that with our higher risk, moderate risk employees. My cyclists, I've got programs. We got 130 people who did the rail rail ride last year, and it was great. We got 10 or 15 people that didn't even have a bike who signed up for it, but they were ready, and they were ready to make the goal. But I've got other employees, they're nowhere near that. So we work with them, taking the coaching model that Art was speaking to earlier, and really trying to help them build their self-efficacy and the belief that they can change, but they got to be ready. And you can't force somebody to move through that stage of change. Everyone is different. So they've got to personally find what's going to motivate them. And usually that's very intrinsic. It is not being paid. It's not necessarily that incentive or that workout bag. We did a lot of programs like that, and we found that our fit people were the ones that were earning them. So now we're trying to build the support systems and the culture. And when an employee does make change, and they send me an email, and I got one of these a month ago, and oh my gosh, I'm still on a high about it. He said, your program and the support that I gave me helped change my life. This guy's going to be a mentor, and we're going to tell his story, and he's looking to help other employees. They're coming up to him, how did you lose 50 pounds? How'd you do that? You're so happy now. Your attitude has changed. Now, my job is to help pull him in. He's ready to help people. So he's going to be one of our biggest champions to help pull some other people who maybe didn't believe they could change, but now they're starting to think about it because they saw somebody else that they can have a relationship with that's their coworker, not the wellness director telling them to change. So,
thank you, Susan.
Thank you.
Thank you for that. They were fabulous. I am so glad to be the moderator here at Well, and I'm still feeling well. Thank you.